Hey everyone, welcome to the Doctor in 60 Weekly Recap, where we package 7 high-yield clinical videos from the week into one quick review. Whether you're prepping for Step 2 or just want to keep your clinical thinking sharp, you're in the right place. Let's jump into what we covered this week. We kicked off the week with sepsis, one of the most high-stakes diagnoses you'll face. If you suspect sepsis, time is tissue. Get blood cultures before starting antibiotics. Order a full panel including labs like a CBC, CMP, lactate, and a chest x-ray. And don't forget to start fluids right away at 30 milliliters per kilogram for anyone who's hypotensive. We used the mnemonic FLAB-C to remember: fluids, lactate, antibiotics, blood cultures, chest x-ray. On Monday, we simplified how to approach sore throats in clinic with the Centaur criteria. You get 1 point each for fever, swollen lymph nodes, tonsillar, exudates, no cough. Age matters too. Add 1 point if under 15, subtract 1 if over 44. A score of 3 or more? Think about rapid testing or antibiotics. The shortcut to remember it all: flat for fever, lymph nodes, age, tonsils. Tuesday's topic was heart failure, something you'll see again and again. Start with oxygen and loop diuretics to relieve symptoms. For long-term survival, begin an ACE inhibitor or ARB, and once stable, add a beta blocker. If the ejection fraction is reduced, you may also use spironolactone or SGLT2 inhibitors. Also important, watch their salt intake and daily weights. Midweek, we covered a common Step 2 question: how to tell the difference between a stroke and a TIA. A stroke lasts more than 24 hours and shows up on imaging. A TIA is brief and leaves no damage on a scan, but both are emergencies. Start a workup with a head CT, carotid ultrasound, and ECG. Start aspirin, statins, and control risk factors without delay, even if the symptoms went away. Thursday's Pearl was all about how heart failure shows up on a chest x-ray. Look for classic signs like a big heart, dilated upper lobe vessels, curly B lines, pulmonary edema, pleural effusion. Use the ABCDE method: alveolar edema, B lines, cardiomegaly, dilated vessels, effusion. Confirm it with BNP levels or an echocardiogram. On Friday, we covered how to treat pneumonia based on where the patient is. If they're stable and outpatient, give azithromycin or doxycycline. In the hospital, not ICU, use ceftriaxone plus azithro. In the ICU or high risk, add vancomycin or Zosyn. And always think about Curb 65 to guide where they should be treated. Finally, we wrapped up the week with a rapid-fire look at aortic dissection. The classic clue is tearing chest pain that moves to the back. Check for blood pressure differences between arms. Start with a chest x-ray. Look for a widened mediastinum and confirm with a CT angiogram or TE. Type A dissections involving the ascending aorta need surgery. Type B involve the descending aorta and can usually be managed with beta blockers. That's a wrap for week 1 on Doctor in 60. These quick pearls build day by day, but putting them together like this helps you see the bigger picture. Want to get these weekly recaps in your inbox with bonus tips and mnemonics? Sign up for free using the link in the caption. And if you found this helpful, like, subscribe, and let us know your favorite case this week. See you next week for more rapid clinical learning in 60 seconds or less.